Hi everyone, my name is Dr. Surakshith Battina. I'm an endoscopic surgeon, a reproductive medicine specialist, and a cosmetic gynecologist working at Indigo Women's Center, Chennai. Today's video is going to be a recorded version of a Zoom meeting me and a couple of colleagues had a few days back, where I have explained about my journey in cosmetic gynecology and where I believe cosmetic gynecology is heading in India. So sit back, relax, and enjoy the video.
So our first speaker, who will tell you how to venture into this field and how do you start the journey, is none other than very handsome Dr. Surakshith Battina. He's an endoscopic surgeon, he's fertility specialist and an aesthetic surgeon, and he's a trainer for many major institutions like J&J and Medtronics and CMAST. Welcome, Dr. Surakshith. Stage is yours.
Thank you so much, Dr. Vani. So, thank you for the introduction. As Madam said, my name is Dr. Surakshith Battina. And in today's video, I'm actually going to talk to you a little bit about my journey of how I actually got into aesthetic gynecology and where, in my perspective, that we are heading. So, the first part of my talk I call is the calling. My first desensitization to cosmetic gynecology was that I was always performing these procedures called hymenoplasty. It just happens that all of us probably do that. We just did not think it was actually more of an aesthetic procedure. And what I used to do preoperatively, I used to check the patient whether she has any kind of hymenal tags. If she had tags, I would say, hey, you know what, I'll be able to help you out with this. If she did not have any hymenal tags, I'll tell her, sorry, I don't think we'll be able to do any kind of procedure for you. So that was my first desensitization to cosmetic gynecology. I mean, I did not even know I was practicing cosmetic gynecology and I was already doing that. My second encounter was when one of our patients came to me and asked me, Doctor, can you do this thing called as a vaginal lightening? I was shocked. I was like, what is vaginal lightening? I never heard this thing before. She's like, no, doctor, LVB. So it didn't really make sense for me. I was like, it's laser vaginal bleaching. I was shocked because of two reasons. One, that she came to me, a male gynecologist, and asking for this particular procedure. And the second thing is that, the kind of information she had, even I did not have. So that was when I thought, okay, I'm going to make a first step. I'm going to understand what it is and, try to get more knowledge about these procedures. My third encounter was when the first Thermi was introduced. So this is like an RF device, and in this device, when they put it up on stage and they showed me how it works, I was kind of impressed, I would say, by the device, because if this application is possible in the vulval area, I could definitely see why some women would want this. So, and then I understood, like, okay, this is what some women can be benefited by this procedure. But only problem is I did not like the way we have to use the RF device. It looked like more of an erotic massage for me. I was not very happy in using this device. So that is when I thought, okay, maybe I should take a back seat. Maybe this is just not for me. And then I started doing my research into finding out why is it that in today's world we do all of these procedures. What I understood when I was doing my research is that this is not something new. We have actually been using energy for several centuries, not years, centuries. It has been there during the Amazonian times, the Egyptian times, the Roman times. In fact, only difference what has happened since then is that the way we actually apply energy inside the vaginal canal has changed. So previously, where they were using heated stones, heated metals, and everything putting inside the vagina. Today, we use advanced technology like the lasers. So we have always been using it. Only difference is the way we apply energy inside the vaginal canal has changed. And also, what I've understood is that the clitoroplasty, in fact, has been done in 1 AD. So that was like the first time when actually it was done. So you can imagine this is not something very new. In fact, we think that this is a very new subject just coming out. It's actually not the case. It has been going on for several centuries. And I was thinking, why? So why is that we are doing all of these procedures? So when I was started to look at the human psyche and everything else, I understood that humans, we as such look at aging like a disease. We always try to go and find the elixir of youth. We don't want to be quiet. Even though we want to always say, you know what, nature, you cannot tell me what to do. I am the master of my own thing, so I want to make sure that I am looking young. This is the reason why when we get up from the bed, we go and put makeup. So why do we have to do that? Why is it that we color our hair black, not white? Because staying and looking youthful is something what we like to do. whether you like it or not. That's what we like to do. And in fact, the beauty also, if you look at it, has transitioned over several years. In the 60s, healthy women were supposed to be very attractive. In the 90s, it was all skinny women who were supposed to be attractive. And in the late 2000s, it's all about the Brazilian lifts and the Brazilian breast. So this has become popular. So you need to see there is a trend in how the beauty is changing, but some things always remain the same, like the smoothness of the skin, the symmetry, and also the youthfulness. So these are three things which are always a constant. No matter what you say, these constants are never going to change. No matter how what the beauty might change, the constants will always be smoothness of the skin, symmetry, as well as the youthfulness. So why is it like this? It has improved so much more than so many other previous centuries before. For example, the media knows how to grab your attention. They want to make sure that they have your complete undivided attention. For example, if you look at this billboard over here, this is a billboard for a burger ad. Okay, how is it that this thing is able to sell burgers? After seeing this ad, a lot of people have actually started going and buying burgers. So the media has found ways to go and sexualize everything, and it works for them because sex sells. Everybody knows that. So what happens is that when we all look at these things, we think in subconscious level, we think, hey, this is the new normal. This is how we are all supposed to do. So this changes the perspective of what is the actual normal. The problem with this is that the world, the media worldwide is the same. Like how we have something in Milan is the same thing over here in India. For example, if some design is very popular in Milan, it's going to be very popular over here. If in case some particular food is very popular in the New York, it's also very popular over here. So why is this so? It's because the media is the same. But the only problem is our training for patients who are looking for this particular procedure is at least a good 10 years behind the United States. Okay, the problem is the searching for all of these things have increased by 120%. People are searching for these procedures. Everyone is googling. Almost 120% rise in cosmetic gynae procedures have been there in the past 4 years. So now once doctors, what they do, they recognize there's a void. They're having patients coming and asking for these procedures, so they have a look for the quick fix, which is the one which gives them the fastest time they can get the term cosmetic gynecologist in their degree. So go ahead and we get trained ourselves, and the best part is some people, they train themselves and immediately they start training others as well. So less than 1% of the people are completely doing cosmetic gynecology. More than 3% of them are training other gynecologists, and over 10% of us are actually treating patients. So what is wrong in this way of doing it? There is nothing wrong, but there is some issues what can happen. Due to the sudden growth in popularity, all of these companies have started coming into India. Previously, they were all sleeping over all of us, but now suddenly they thought, hey, you know what, India is a big market. I think we should definitely go in. They started coming in. So these companies have started placing guns in the hands of children. Basically, they are giving all of these machines in the hands of gynecologists. So that is a challenge. Yeah, it is easy, it is safe, it is cheap to do. All of us can do these procedures. Even someone in the parlor, a lady will be able to do this procedure. It's not about having the machine, but rather to try to develop this thing called as the aesthetic sense. Okay, I've seen people who are using diode lasers inside the vaginal canal because the company said they have a probe for it. See, again, if you do not know anything about the lasers, you first have to understand the basics of everything before going ahead and applying these. So the problem is we started selling a commodity. We are not providing the patient a solution, but rather giving them a commodity. We are letting the technology decide what we are able to do. The issue with this approach is that you will have the technology, the next gynecologist will have the technology, like three other people in your same street will have this technology, and then it becomes a price competition. So you will undercut the other person will try to undercut you, and then finally the whole purpose of doing this procedure is lost. So what is more important we need to understand is what is the aesthetic sense, the better thing we need to create for all for our community. So it is a conscious effort which you have to do from your side to get this thing called what we would say in the aesthetic gynecological segment as the vulval harmony. So every time you examine a patient, just don't go ahead and directly do a PV. Have a look at the labial, the labia majora. Have a look at the labia minora. Have a look at the symmetry, the length. All of these things you try to understand where the anatomy comes from. So once after that, you will know, okay, see, the texture is different, the look is different. So how you can trying to identify the different kinds of labial architecture for everyone. So that is the first thing. The second thing is do your own episiotomies. Go ahead and start using a 40 and 50 sutures to go ahead and do all your. Don't give it to your resident. You do it. So this will make you trained in using these very tiny sutures, because initially I had such a large difficulty in using these sutures that I used to call my cosmetologist to come and help me out. But then later I got very comfortable with them because of this thing, that I started using all the episiotomies by myself. You can be a top obstetrician, you can be a top gynecologist, but when you venture into something new, you have to look at it like how you look at it as a resident. Okay, you cannot think, hey, you know what, I can do like 100 hysterectomies in a day. But when you're going into something new, have a look at it in the eye of a resident. So that is the only time when you will be able to learn. Most like just like how most of your other specialties require you to have a certain amount of training before you go and do something, cosmetic gynecology is no different. You also require the same kind of training when you do this procedure. So when I tell something, I say there can only be one Michelangelo. Of course, we know so many artists, but there is only one Michelangelo. But even if you remember, Michelangelo takes several years to complete one art. He's only human. So even some gynecologists, they come and tell me, you know what, this procedure, I can do this in 2 minutes. So in 2 minutes, you're not going to get anything. Okay, in 2 minutes, like even someone like Dr. Pelosi, who has around 20 years in performing cosmetic gynecological procedures, he 120 minutes for one labioplasty. So how can a person who has just ventured into this just take 2 minutes? It's not possible. But the problem over here is that 2 minutes to do a procedure, we call it as a botched procedure. Okay, unlike an art, you can just scratch the whole thing and you can change your art. But when you mess with the patient's life, she's going to haunt you for the rest of your life. So please understand that and try to take precautions. Like, for example, I'll give you certain examples of what happens. The first patient, she goes and searches on Google. She searches like, what is the top cosmetic procedures available over here, and then she has vaginismus. So she thinks the first thing which is going to pop up are the dermatologists and then the cosmetologists, because you know what, they're already in this field, they're also very strong in this field. So she's going to go to her. The problem with the dermatologists, I mean, more the cosmetologists, is that they're not very comfortable in looking at the vaginal area. Like a gynecologist, they'll be like, yeah, you know what, let's do an examination. That kind of inhibition is not there for us. But sometimes the cosmetologist will have that inhibition. So she won't even look at the patient. She'll say, let's go and do a Botox for you. You know what, because you're having vaginismus. And the lady might have taken a second opinion from a gynecologist, and then she would have understood she only has candidiasis. So, you know what, this is what is very important, trying to completely understand where the concern is, and trying to know that this is something which has to be done by a gynecologist is absolutely essential. Sometimes the cosmetologist is absolutely brilliant, like they know exactly what they're doing, they do the complete procedure, they do the best labioplasty for the patient. But the problem was, the patient would have said, I don't want a labioplasty, I wanted the labia majora to cover my labia minora. So at the end of the day, she loses a labia minora, and she also has a sagging labia majora. So understanding exactly what the patient wants, put in a mirror, make sure you and the patient exactly know what you're doing, and then take the next step. The most challenging part to have when you go to cosmetic gynecology is that you have to tell the patient you are not a magician. You know what? As an obstetrician, I find this very difficult. The dermatologists, they're very good at doing this. They can tell the patient, they know how to manage the patient expectations. We are not very good for managing patient expectations. So we need to learn this. Inculcating yourself to learn this is absolutely essential. You can give the best results for the patient, and the patient might not be happy. And you cannot give the same result for all the patients every time, because everyone heals differently. This is not your problem, this is not your how do you say, limitation. It is a limitation of the cosmetic procedure by itself. Like, for example, if a patient comes to me with severe laxity, and she tells she has her mind stuck on only having a non-surgical procedure, so how do you go about this? I tell her first, I'm going to give a session of laser vaginal rejuvenation at a discount of 20%. You tell me how you feel. Because I don't want to lose the patient because if I don't do it, she's going to go to the next person, she's going to do it. So you should not lose the patient. At the same time, do not demeanor. Don't tell her like, you know what, this is not going to work. You try it for the patient. Sometimes some people will have a psychological effect of that it has helped them in this particular way, and they will be going for the other two sessions as well. So you would never know. If you think a patient has heavy laxity as well, just for the mental aspect of it, you can go ahead and do a laser vaginal rejuvenation. You can always give them a discount, so they'll be better. For SUI, I would never give a patient only a single sitting. If a patient says, you know, doctor, please give me a single sitting for SUI, I would never do that. I would never give them. I'll be like, you know what, you either take the 3 sittings or don't take anything at all. The other challenge, what we need to understand, which is very specific for cosmetic gynecology, is called as the body dysmorphic disease. This is something you need to identify. As a doctor, you need to identify, because there is 1% of these people in the complete population. Around 10% of them are going to come to your office. The reason is because you are advertising yourself as a cosmetic gynecologist. So there will be an influx of larger people. In fact, those will be the first people you get. So you need to understand when to say no. Okay, so that is very important. And the second thing what you need to develop is, as Dr. Vani has also told, is that you need to develop a perfect team. It's not just you. You need yourself. You need your cosmetic friend, your cosmetologist, a cosmetic surgeon. You also require a psychologist, and also you require a marketing specialist, because this is where it is going to differentiate you from the rest of the competition. Okay, you cannot integrate this with your ops practice. I don't know how people are doing this. You cannot integrate it. People say, you know what, I'm going to do this procedure for you for a 20% is going to, after a normal delivery. She's not going to come to you, because she does not really feel the need of that still. That need is going to come only much later. So there's absolutely no point of you offering these treatments for them. You rather just offer this for people who would want this treatment. And the other important thing is, many people say, doctor, can I practice cosmetic gynecology? And then she'll be sitting in an Apollo hospital. I'll be like, it's impossible for you to do that. Most of these patients are very secretive. You know, they don't want to come out and tell you that, hey, you know what, I have this problem. But when you're doing something in a corporate, you know the number of channels you need to go to. So that itself gives a kind of fear for these patients, and they are not going to come to you. Please understand, these are not your patients. Okay, they will become your long-term clients. Why I say clients is because they're not here to you because you're a very famous obstetrician. They're not here because you're a very famous gynecologist. She's here to see you because you are providing her a solution which she has found on the internet, and she is very closer to you in proximity, not because of your obstetric practice. So you need to understand that. So you have to look at her as a new client, and you have to know how to consult her as well. In fact, I asked some of my patients, you know, how did you actually know about this procedure? And what most of them say is that, you know, they were unaware up till this point, and only after they saw my ad, they understood, hey, you know what, this is possible. So I think we, all of us, have to take this opportunity to start educating the public. I think more than, yes, educating ourselves also is important, but more importantly, we need to start educating the public as well, that we should do it very carefully. So another thing is, we are all over here just mastering this art. All of us over here. And none of us here are experts because the techniques are still not final. We are all learning these techniques. Only after we know all of these techniques, only then, when we are able to combine and hybridize and tweak and, you know, these procedures, only then we can call ourselves experts. All of these have a little bit of a learning curve. For example, something like a Botox or PRP, you can just get yourself trained. In fact, 90% of the people who are training themselves nowadays is only in Botox and PRP. That's just like, probably I would say, the first 20% of cosmetic procedures. Something like a liposuction, filling will take a little bit of a learning curve. Maybe 3 or 4 days training program is absolutely essential. Things like labioplasty and hymenoplasties and, you know, majoroplasties, they require you to actually have at least a couple of different trainers train you, because you need to know all the techniques before you can go and start integrating them into your practice, or before you can take the scalpel. And some other procedures like the breast lift and the butt lift and the, you know, the lipo molding is what they say. These will take you with your cosmetologist. So that is why the team is absolutely essential. I'm glad that most people recognize that this is not a solo practice and is not going to work that way. And learning to be an expert in social media is key. Is key. You have to look at people like Dr. Miami and Dr. Feel Good. All these people are absolutely brilliant in their way of marketing. We are not still there. We are just learning right now, and you have to have some marketing in your hospital, taking videos of these procedures, showing before and after, making skits, making it entertaining for the patients. We have a long way to go, but definitely we will get there. So a master in this art is always able to hybridize and able to combine treatment. So that's the end of my presentation. So I hope I was able to provide you some basic value today, because the future of this field is in our hands, because we are all the pioneers, we are the inventors for this in India, and we all should make sure together that we give information for the patients, and not just provide a treatment what the machine tells that we can provide. In fact, give a solution for the patients. So I say together, let's add life to our years and not years to our life. So thank you so much for patient hearing. Thank you.
Like you are providing, Dr. Surakshith, you want to say something else about the training as well?
Yes, madam. I think definitely training in India is still in the very beginning stages. I think definitely we have a lot of way to catch, because more importantly, we need to start training people on the aesthetic sense and just use these machines and link how, because sell the machines will be able to do that for you. But ideally, we need to start inculcating these aesthetic sense and marketing, which I think most importantly, what we all have to really think about should definitely be there in the training programs as well. And I think definitely INSARG take very big initiatives in this, and I think we will have such good training programs also available in India very soon.
Somebody wants to say?
I'm so sorry. Yeah, I just thought of addressing this also, the return of investment. I believe we're still not there yet to really expect the return of investment fast, but rather machines are there to tell other people, the general public, hey, you know what, we are doing these procedures, So they give that confidence for others to come and visit your clinic. You just cannot start your aesthetic gynae practice and not have any machines with you. It is really not going to help you at all. I think, as madam has said, return of investment comes last. So the only reason why we are able to put all these procedures for a lower cost is because return of investment is actually not in our minds. Ideally, right now we are in the learning stage. We are trying to propagate this field. So I think together, definitely, once the information is out and once the ball keeps moving, definitely the prices of all of these things will come down. So since we are all like the I would say the pioneers and the inventors of these things, we're just taking the first step.
I hope you got some good information from this video. A lot of my gynec friends have actually appreciated me for this particular talk. They really like my approach towards cosmetic gynecology. And if you got some value out of this, please make sure you leave a like on this video. Do subscribe to my channel and follow me on Instagram. Alright, until the next one guys, I'll see you and have a great day.